And today it's my pleasure to host a team from Canada. Just as we've been doing in the last 3 or 2 months, we are talking about COVID-19. And our topic today is how come Kenyans in Canada are some of the least affected people around the world when it comes to COVID-19. There's a lot to talk about this, and it's my pleasure that I have a representative from the consulate to give us not only just the figures, but also what the consulate is doing, the High Commission in Canada is doing in terms of supporting Canadians. And straight away, we go into this, and I want to introduce you to Sunir Chandaria, who works at the consulate, just to tell us the kind of, give us statistics on how many cases that we already have right now. As the country now starts opening, as you know, in America, we are open this weekend. In Kenya, we are likely to open up in the next 1 week. So Sunir, please give us a sense of how the case is in Canada in terms of how many Kenyans have been affected and how the consulate is involved in all this.
Sure. So Chris, first, it's a privilege to be here today. Thank you for having us. It's just to be, I guess, to share with everybody, I represent Kenya here in Toronto. I'm the Honorary Consul of Kenya in Toronto, just over 3 years now in that. And again, given our family's deep connection to and heritage in Kenya, over 100 years since our family first landed and set foot in Kenya, it's a real privilege to represent such a wonderful nation here in Canada as well. We've got about 20,000 members of our diaspora from Kenya here in Ontario alone. We are supported by both our High Commission in Ottawa, led by His Excellency John Lanya Sunya, and then we also have our consulate here, Honorary Consulate here in Toronto. And then we've got representation also out in Western Canada in particular. And then additionally, Ephraim and his team at the Kenyan Canadian Association has been great at staying in touch with, at the grassroots, if you like, with our Kenyan diaspora here in Canada, in particular in Ontario, with people like Phoebe and others on the COVID task force as well. Numbers-wise, again, 20,000 Kenyans in Ontario. Across Canada, our number, Ephraim mentioned earlier, about 35, which is in line with an earlier number that I have on the record, which was 30 2 weeks ago. So it seems to be fair, about 35 Kenyans in Canada are affected by COVID. We have, to this point, had 0 deaths from COVID amongst our Kenyan diaspora in Canada. Of the affected, I believe there's a couple in Calgary, 1 in Montreal, 1 or 2 out in Vancouver, and the balance are indeed in the Greater Toronto area, where again, we have a deep concentration of Kenyan diaspora as well. Perhaps not surprisingly, a number of these affected Canadians or Kenyans in Canada are folks who are playing roles on the front lines of the healthcare, in long-term healthcare facilities and communities and elsewhere, as PWPs or PSWs, who are Kenyan nurses or similar in Canada and operating in that capacity. So they are on the front lines and therefore perhaps disproportionately put themselves at risk. But that perhaps tells a bit of that narrative as to why it is we have even that number that are getting affected. I would say beyond that, what you'll find, of course, is Kenyans in Canada, Kenyans broadly, but certainly those in Canada we're speaking of here, we're intelligent people, we're generally compliant people in Canada. And for these reasons, Canada's numbers overall have been quite good, I think, compared to a lot of the developed world, a lot of the world as a whole. Usually Canada compares itself to the US and the UK on lots of issues, and compared to the 2 friendly nations of ours on this particular journey with COVID, we certainly stand out versus the challenges that those 2 countries have been enduring. We also have a lot of space, one can argue, in Canada, although in Toronto, we do endure some of the challenges of a bit more concentration of people as well. The interesting dimension, maybe if any, of our diaspora here, it relates to students. We do have students who are here in Canada, who have been here on visas, etc. Visas, of course, are not so much of a concern anymore as far as the expiry globally right now. But these are students who are in Canada, who are perhaps now stuck in Canada beyond the term time, if schools have shut, etc., whatever the instance may be.
In fact, Sunil, we'll come back to that because our viewers in Kenya, especially, many parents who have their students in Canada have a very interest in what you're talking about.
And the reason I mentioned that is you asked me some of the official requests we were getting in the consulate.
Yeah.
And I've had a few requests from folks who are students who are either curious as to their status or curious to get home. We've also had Kenyans who are here on vacation or otherwise, and perhaps have now felt a need to get home. They've got work to get back to, they got their business to get back to, etc. So those have tended to be the more acute queries I've received, really looking for assistance. And to be fair, we've actually been able to help some of them, direct them and guide them on how to get home. Last week, I know of at least a handful who got home back to Kenya safely from Canada as well. So, that's an interesting comment there as well. But yeah, people are otherwise being incredibly patient and incredibly, frankly, just fantastic and enduring a very tough and uncertain stretch, a peculiar stretch for, I think, now over 70 days in Canada.
Thank you, Chris. First of all, is to thank you for giving us an opportunity to be here, and especially to discuss about the current crisis and how the Kenyans are coping in Canada. First of all, my name is Ephraim Maura, and we are actually working very closely with the various groups and organizations here in Canada. Kenyan Canadian Association, myself being the president, and we have a board and a council, and we're working in 18 regions across Canada with most of the victims or the patients of COVID-19 being here in the Greater Toronto area. And I would like to say that we came together once the crisis started, after realizing there was a major outbreak of COVID-19 cases affecting Kenyans, especially those in shelters. Kenyan Canadian Association having a newcomer settlement program. We discussed it with various organizations and groups of Kenyans here in Ontario, and we formed a COVID-19 response team. And through that team, Phoebe has been helping us to coordinate most of the work, especially putting together the data of the Kenyans who have been affected. And so far, as the mission in Canada are aware, we have about 35 cases and 0 fatalities, which is a very good thing. And once we came together through the COVID-19 support team, we've been able to supply and be able to have a very good supply chain system so that we're able to support those Kenyans who've been affected. And so far, we're happy to say we have like almost 0 active cases over the last 4 weeks. And we've worked also very closely with the newcomers. As you understand, most of the newcomers here in Canada, when they came over and the crisis came, we didn't have a way of having them go back to Kenya. Most of them are stuck here, and we had to do something as a response team. So we set up a response fund, and Phoebe, I'm sure she's going to talk a bit about that, and how Kenyans have been very generously responding to these cases. We've come together, and also we've had very good support from our consulate through Mr. Sunil Chandaria and the Kenyan mission in Canada in Ottawa. And we must say we are very happy that things are rolling out quite well so far.
So Phoebe, I know you're in charge of giving us the statistics and mapping to know exactly where the cases are. Can you please just, apart from just introducing yourself, also give us a sense of how you are tackling this issue in Canada?
Thanks. I just want to introduce myself. My name is Phoebe Kagumba Sibanda. I've been in Canada for the last 20 years, and I'm happy to be here. I just wanted to add on to what has already been said. Oh yes, and I have my family back home in Kenya. So there's my Kenyan connection, big time. So I just wanted to say that. How this COVID-19 support group came about is that different groups felt there was a need. They were all doing their own little thing. And then there were also individuals within the community who felt that they all wanted to work together. If we came together with a common purpose,
Phoebe,
we can do better than everyone trying to raise their own little funds in a place wherever.
Maybe
So,
let me stop you right there. There's a lot of movement on your camera. Can we stabilize
I'm
that?
sorry.
Yeah. There's
okay. Is that better? Okay, sorry about that.
Yeah.
Okay. So what we did is we all came together and formed this collaborative team or response team called the COVID-19. It's made up of the Kenyan Canadian Association. There's Tumaini Nurses International. There's also an informal group or WhatsApp chat group called the Kenyans in Solidarity team that we all came together, and of course individuals. Many of them are individuals like myself and others. We are members of the community who wanted to work together to try and see what we can do to support those in need. And we've actually done very, very well, as Ephraim has already mentioned. And what we do is that we actually get data from the ground. We have volunteers within our team who actually are in touch with those who are actually going through the COVID-19. They've actually been affected by it or infected, let me be more precise. And we look to support them because the system in Ontario already provides healthcare and the required healthcare needed. So we have come in to provide the moral support and the other complementary support to make it easier for those who are going through the illness of COVID-19. And we're happy to say, and I'm happy to say that, as has already been said, we have had no fatalities. That's really good. And we have, there have been a lot of the people who have gotten the illness have recovered, and they are actually now looking into, finding their own space within the Kenyan community in terms of accommodation and trying to get themselves back integrated into the community.
Awesome. So, Maura, it's almost unbelievable that we've never had any fatalities among Kenyans in Canada, as compared to other places, especially in Europe and also in the US. What would you attribute that to?
First of all, I would like to thank the Kenyans here in Canada. The fact that immediately the self-isolation orders were issued by the various levels of government, we quickly hit that. And the other thing I would like to say is that Canada, as most of us are aware, has a very robust health system. So even after we had an outbreak at the shelters, even those Kenyans who are not documented or those who are in the process of naturalization, the government was able to respond very well. KCA, Kenyan Canadian Association, we've been working with the various levels of government just to ensure that most of the newcomers are well handled. And if you look at the statistics so far, arguably you can say 80% of those affected are newcomers because most of the outbreaks were in the shelters. And some of those who are already coming from shelters are looking for residential areas. And we were able to respond very fast, that being the other thing that made us have a very few statistics. Then we've also worked very well with our embassy, especially through the consulate here in Toronto. And the other day, we just had a webinar with the group that is most affected, the newcomers. And we've been able to try to discuss and address some of these issues, especially on the COVID-19 and how they're also affecting the newcomers. So we're very happy, and especially the way also Kenyans came together. We came up with a response team, and we put away all the structural and different factions. We have so many organizations here, especially here in the GTA where most of the Kenyans are. And we focus very much on those who are really affected. And that has really helped us to bring the cases down.
Sunil, you see, we've one of the things that has really exposed the Kenyan consulates in this COVID situation is, the kind of confusion that reigned soon after, especially the lockdowns. Speak to us about how the Canadian consulates are swung into action and make sure that Kenyans don't suffer. We had cases especially in China and other places where many Kenyans in the diaspora were stranded and they didn't know what to do. How did you? What informed your actions during that time?
The reality in Canada, to our spirit. I mean, Canada is arguably the most multicultural country in the world. Toronto is probably undoubtedly the most multicultural city in the world. And so it's in our fabric, in our spirit, to embrace and protect all citizens and humans in Toronto specifically, and in Canada, across the country. So to that end, what you've got here is Kenyans in the diaspora who are certainly part and parcel of Canadian society. You've also got, they're Canadian citizens in many instances. Then you've got the newcomers that Ephraim noted, that Phoebe spoke of as well, who are maybe on their path to naturalization, but maybe are not there yet. And the wonderful thing is the Canadian government, municipal, provincial, federal, all the apparatus that the Canadian government has made available to people in Canada has been made available to you writ large, whether you are a citizen or not, because you are in Canada at the time of this pandemic. And then you couple that with a healthcare system that, of course, we've got a national or provincial, but a social healthcare that is provided for our citizens and our people in Canada by the government. And therefore, you've got a pretty good social net there, which can assist and support just about anyone who happens to be here, whether transient, temporary, or as a citizen, and permanently so in Canada during these last 70 or 80 days, as the pandemic has really heightened, resulted in the lockdown that you mentioned, etc. The key always is the communication. We've had the benefit here. Our Premier is on effectively every day in Ontario. Our Prime Minister also communicating very regularly through the media channels, etc., what the status is and all that. And as one of the challenges for us, and I am serious about this because it's almost forgotten in all this, is for Canadians, it's relatively easy to contain, self-quarantine, and stay home for the months of the year when we have cold weather out. So this began in March, right? March is kind of into our shoulder season, March, April, May even. And thankfully, we had some really, really unseasonably cold temperatures until maybe a week or two ago. 2 weeks ago was Mother's Day. It was snow flurries on the ground here, and it was 0 Celsius freezing temperatures. So that helped to contain people indoors, helped in our efforts just from the fatigue that eventually sets in amongst us humans, with staying compliant with the orders and the asks of our government. One of the challenges is that suddenly in the last week, the weather has turned favorably and swung way favorably, where yesterday and today it's 25 degrees or so outside Celsius, clear skies on a weekend, although who knows what day of the week it is sometimes anymore anyways. And as a result of that, sadly, people have, it's just humanity, I guess, human nature, have embraced this moment and felt this freedom after a long, enduring, peculiar challenge or journey of staying indoors. And what's happened? The numbers have spiked instantly. The last 3 days, back up again. So the challenge is, we're not out of the woods yet, I guess, as far as how the officials, the professionals will view it. And the challenge will now be, how do you balance containment after 9-10 weeks of containment and good weather, which draws everyone out because our summers here, sadly, are pretty short anyways.
That's right. Phoebe.
We're going to see how we navigate that.
That's correct. Phoebe, you are the person who is in touch with the communities in terms of the cases that you receive. For instance, how do you identify the cases in terms of those ones who are sick, those ones who have been hospitalized and discharged, and those ones who have completely healed from the disease, from COVID-19?
Okay, that's an interesting question. As I had mentioned a little bit earlier, within the team, we decided to allocate or have 3 members of the team be in direct contact with those who are infected directly by COVID-19. Why this was done was to ensure there is no stigmatization or a lack of confidence for the patient to want to come out and reach out to us for help. And we also, at the same time, wanted to ensure that we keep the confidentiality of these individuals. As Ephraim had mentioned, and so had the consulate, that the COVID-19 has no bias as to who gets it. It can be somebody who is very well, settled in the country, or somebody who has just found their way in and they're still trying to find their feet and gather their way. So they may be undocumented or documented. So to ensure that people are confident with our team, we got 3 individuals in the team who have that direct confidence, and community are able to confide in them or reach out to them directly. We get the information directly from these 3 members who are very well placed and the community members of high integrity. And the information we've been getting and the data we've been holding is actually very detailed. It goes right to where are these individuals living? What is their current status? Where are they, what stage of the COVID-19 healing process or infection process are they at? And how do we deal with them? Because as I had said earlier, we are dealing with those who are actually unwell, and some are hospitalized, I think, but they have already come out, from what I understand, which is a really good thing. But they've come out of intensive care in hospital, but they are in the healing process. Some are still in the shelter environment. Others are integrating into the community. And as I had mentioned, we also try and support them with the small items that can help them in terms of, what do you need? Other than the general stuff they'll get from the shelters, because they'll get the accommodation there. We also try and provide things like PPEs and other supplementary stuff that they will require to make their life a little bit more easier, and where they need to get, where they are moving out of the COVID situation because they have healed, because, they will not also be released by the officials within the shelter if they are unwell. They have to pass the test of becoming, free from the illness before they're released into the community or into society. So once they are at that level, then we'll also try and help them with small things like beddings or something to keep them going, so that at least when they are renting a place or, if somebody with a room, renting a room maybe in a house, they have some basics to kind of get going as they now proceed with trying to get themselves into settled.
That's right. Maura, I know you spoke about this briefly, the unity in diaspora. One of the things that has been undoing for Kenyans in the diaspora is unity of purpose, especially. I know in Canada we used to have a KCO. The 3 times I've come to Canada, I've come there because of KCO. But in the recent past, everybody knows what happened to KCO. I'm not even sure that it still exists. But I'm happy that at least now, your organization is filling in a lot of those empty spaces. Could you just please speak briefly about the need to come together as a community in times like this, very challenging times like COVID-19, when you don't know what to do, and there isn't really anywhere to go apart from just the people that you know?
Thank you, Chris. I must say that one of the issues that I think every newcomer grapples with when they come to Canada is coming and finding that we have so many organizations, we have so many groups of Kenyans here. And I must say it's not a bad thing, because when I came here, as you said, we found other organizations here in Ontario And it's not just KCO, we have other smaller groups for different communities. We have others with different objectives. And one of the things we did with Kenyan Canadian Association, being a federal organization, is to try to bring all these organizations together. That's one of the objectives of KCA. And we are really highlighting on the issue of collaboration.
Sunil, as we summarize our show today, there's a lot of anxiety among parents in Kenya who have their parents, their children who are in school, in college, in Canada. There's a large Kenyan community in Canada, especially students who are going to school, and suddenly the countries were shut down, the planes were not flying. What have you done as a consulate to make sure that those young people who don't know what to do are taken care of? Because for them, the only home that they know apart from Kenya is their consulate in Canada.
Indeed. I mean, briefly, there has been a real challenge. The school year ended in Canada for the university students in particular during this pandemic. And so there were many folks whose visas would normally have expired in the course of that ending of their school year, or otherwise, there are instances where residences they were in had to make decisions about moving students out. And people who didn't otherwise have plans to be in Canada for the summer, whether they were finishing their degree or returning home to come back again for the next school year, were now suddenly stuck in Canada. Again, I think the first and most important thing to emphasize is the policy of the Canadian government has been a clear one, that your expiration of your visas or any of that is not a consideration at present. You're not required to leave during a situation like this when you cannot physically leave anyways. So put your mind at ease on that front, but that isn't sufficient for many. They still need to have an alternative plan in place, whether it's means, a place to stay, or something productive to do. And so we've had a couple of different instances, which we are familiar with now, where people have either pivoted and found themselves, some work, etc., so they can generate some income and spend their summer or longer, depending on where that goes, in a sustainable manner. And then other instances where people made the choice to get back home to Kenya. And I mean, it's not an easy or natural path, but it certainly has been feasible. I know of a few people last week who took a flight, because there still is a daily flight, if I'm not mistaken, from Toronto to London. And London has just introduced in the last few days a new policy on quarantine there. But prior to that, Canadians would fly from Toronto to London. And then there have been at least 2 or 3 now KQ flights out of London back to Nairobi, specifically for, and there are 3 or 4 conditions on this, but Kenyan citizens who have got a clean COVID test and are prepared to quarantine for 14 days upon getting home to Kenya. And so people have made their way to London and connected on from there back to Kenya as well, if that was the choice they made. And we've supported and facilitated a couple of those instances as well, to the degree that we are capable of doing from here.
We've been talking to Sunil Jandaria, who works at the consulate in Ontario, and also Ephraim Mwaura and Phoebe, who are the members of Kenya Canadian Association. I want to thank our team from Canada for finding time to speak to us about this issue. These are very, very important issues. For now, we are just happy that we've not lost any Kenyan living in Canada to COVID-19, unlike any other places, especially in the US. And thanks to the Canadian laws, thanks to the Kenyan consulate in Canada, and how they've moved in, and also thanks to the organizations, Canadian organizations that have moved in to make sure that those cases, that those Kenyans that are affected are well taken care of. My name is Chris Omalwa, and join us again next week as we discuss more about issues that affect the diaspora. And once again, Thank you very much to our Canadian team.